Hello, my name's Dr. Vicky Cleak and I'm a consultant psychiatrist with a special interest in adult ADHD. And today we're going to be talking about whether or not ADHD is a real thing. Now, in case you're wondering, it is, and I'm going to give you some evidence and reasons for why that is. So the presentation of ADHD has been around for a lot longer than the actual name ADHD, Attention Deficit Hyperactivity Disorder. This poem is taken from a book called Straw Peter, which is a book of poetry, funny poems for children to teach them moralistic values, so to speak. And this one is about what happens if, like Fidgety Philip, you rock on your chair, you don't pay attention to what you're told, and you act impulsively, and is one of the earliest descriptions of a child that possibly had ADHD from 1845. So the first known written description of an ADHD-like syndrome occurred in the 1900s, and the diagnosis that we know today of attention deficit hyperactivity disorder came in the 1980s. However, treatment for ADHD was known to improve symptoms in the 1930s, and in America has been used in children quite widespread from the 1960s. ADHD is one of the most researched mental health diagnoses we have, which should give some reassurance about the long-term impacts. It hasn't really been until the 1990s, however, that we've talked about ADHD symptoms in adults. And in fact, when I was training as a General Adult Psychiatrist in the 1990s, the only time I was really exposed to discussion around ADHD was during my child and adolescent 6 months as a junior, and really I've learned about ADHD as an adult, but look back at a number of patients I saw during my training that in retrospect I think had undiagnosed ADHD either as a primary diagnosis that was misdiagnosed or as a comorbidity. I think we now recognise that approximately 40 to 50% of children who meet the criteria for ADHD will continue to experience symptoms into adulthood. Some of those will meet the criteria for ADHD and or their symptoms will cause problems during their adult lives. And I envisage that the next big thing, if you like, that people will start talking about is ADHD in old age, because ADHD symptoms do not go away with age. And I think there is beginning to be a recognition that quite a lot of patients presenting with memory problems, actually a significant part of that underlying difficulty is down to pre-existing undiagnosed ADHD. So what are the basic factoids of ADHD? Well, about 1 in 20 of people in the population will have ADHD. It strongly runs in families. If you've got a sibling with ADHD, you've got a 2 times increased risk of having it. If you are an identical twin, you're more likely to have it if your other twin has it than if you're a non-identical twin. So we know there is a very strong genetic underpinning for ADHD. It strongly runs in families. And that's one of the questions I always ask everybody is, who in your family do you think's got ADHD, even if it has not been formally identified? ADHD traits are on a spectrum, very much like blood pressure. So everybody has a blood pressure number, which will range from low blood pressure, low numbers to high numbers. But not everybody on that spectrum will have hypertension. Only those at the top percentiles will need treatment. And it's the same with ADHD. So everybody has ADHD traits at times. Everybody can be forgetful. Everybody can at times find it difficult to prioritize, particularly if you're anxious or you're sleep deprived. But those people with ADHD, the traits are significant and persistent. And more importantly, are causing a functional impairment. And that's the key issue. So you can have a number of ADHD traits all your life and them not cause any functional impairment at all. And it's only when you leave home or you get divorced or change jobs or any other significant changes in your life that take away executive functioning scaffolding or place additional executive functioning demands on you that the underlying ADHD symptoms start causing impairment across all spheres of your life. We know that there are clear neurological differences between those who have ADHD and those who don't have ADHD, and those differences are present since birth. If we look at functional images of the ADHD brain, someone without ADHD, and that looks at blood flow when a person is given a particular executive functioning task, the two brains look different. The blood flow is different. But when you give the person with ADHD stimulant medication, the brains under functional MRI start looking the same. They're functioning in the same way. So we know that there is a structural and functional difference between the two, which temporarily at least goes away with medication. The other thing we know is that ADHD is not a problem of not knowing what you need to do, but it's a problem of putting that into practice, a problem of doing. So people with ADHD intellectually know the rules, they know that they shouldn't talk over people, they know how to read a train timetable, what they need to do to get out of the house on time, but they can't do it. In my experience, one of the greatest pieces of evidence that ADHD is a neurological problem is the fact that when you give medication, suddenly people that couldn't do it before can now do it, and they have no way of explaining what has changed. It's literally like a switch has changed from on to off. And that, in my view, is why when somebody has got a functional impairment with ADHD affecting their life significantly, that medication is the first line treatment. So you can do as much CBT and people telling you what to do, have as many diaries as you like, but you're still going to have a problem with doing it. There is something neurological going on at a biological level that's stopping the person from being able to carry out what they know they need to do. So traditionally, ADHD was thought to be a diagnosis of naughty boys. The overactive naughty boys were the ones that were much more obvious in presentation. However, it's become very apparent that actually girls are affected equally to boys. It's just that because their play and relationships are very different to boys, their social awareness and play, which is much more based on talking rather than activity, is the ADHD symptoms may not be as obvious in childhood as they are for boys. However, I would say that they become much more apparent than boys in adulthood, when women generally have many more aspects of life that they need to juggle, particularly if they work and particularly if they are carers for children as well as the older generation above them. If you are just an inattentive girl and you're sitting in the back of the classroom with your mind on what's going on outside or what's going on inside your head, but you stay in the back and you're quiet and you're quite intelligent and you're scraping by with your exams, it may not be identified at all at that point. However, if you're a boy and you're sitting in the back of the classroom and you're not really paying attention, it might be a bit more obvious because that's not typical boy behaviour. Our society's expectations of girls versus boys really mean that girls are disadvantaged from having their ADHD picked up in childhood. But what we do know is when you give tests of executive function to girls and boys, those with ADHD will do just as badly as each other. The evidence is all there, it's just that the presentation is different with different expectations. The other thing that happens with girls in terms of puberty and their menstrual cycle is those drops in and changes in estrogen that happen as a result of that has a negative impact on ADHD symptoms. So that is another different aspect of presentation that can occur. Many of the difficulties a child has is put down to puberty, your menstrual cycle, rather than an underlying ADHD. So if an adult has had considerable executive scaffolding, so they've had a very helpful, organised mother, the school's been quite rigid, they've been there all the way through their childhood with no particular changes, and it's quite a structured, rule-based school, then ADHD may not have been picked up at all, particularly, as I said, if your child's bright and they can absorb and work out information themselves without having to do much revision. Then they get into adulthood, they leave school, they go to university, they're having to, as well as manage their studies, also manage the home, the bills, cooking their meals, doing their washing, and then they have families, which means that they've got other people they've got to organise and manage. Then the difficulties start stacking up, becoming more of an issue. When an adult presents with potential ADHD, they're going to be much more self-reflective on what their difficulties are. So may well report more symptoms than they did as a child. The other difference with adults versus children is the overactivity tends to reduce. So they may not be getting up and moving around as much, and instead they may put that need for movement into more socially acceptable ways. For example, biting their nails, which can be managed by having acrylic manicures regularly, or by bouncing their foot underneath the desk or tapping a pen on the desk. However, as an adult, you may be less physically active than a child in terms of doing regular PE, and that can have a negative impact on you. Although overactivity tends to reduce, impulsivity tends to remain the same. So that impulsivity in action, sending emails without checking them properly, or difficulties with speaking over people, speaking without thinking, that may all continue and potentially become more of a problem in the workplace. As an adult, you have more responsibilities and roles to play, and struggling with ADHD for all those years may well mean that you have picked up additional problems secondary to the underlying ADHD, and that can include a number of physical health problems like obesity from overeating and snacking, alcohol abuse, substance misuse, chronic insomnia can have a real negative impact on your physical health. So there may be more illness presentations, psychosocial problems, so problems with your relationships, divorce, moving jobs, potentially losing jobs, financial difficulties, which can all be underpinned by ADHD as a cause, can lead to depression, anxiety, and that can be first presentation of an adult when actually the underlying issue is ADHD. It's very common for me to see people who present really quite late on in adulthood, and it's interesting and important to work out why is that person presenting for an ADHD assessment at this point in their life. And it might be for a number of reasons. It might be that they thought about it but put it off, or it might be because they're now having trouble at work. For example, if they've moved from a people role into a more managerial role with more paperwork and administration, or the person's going through the perimenopause and is presenting with a worsening of their ADHD symptoms, but they haven't linked the two together. So maybe a number of reasons why somebody presents at this particular point in time in their life. It doesn't mean that they have suddenly developed ADHD or that treatment or management of the ADHD is any less valid. So in summary, ADHD is a neurological variance that people are born with. However, the traits of ADHD are common within the population, and having traits does not mean you have a diagnosis of ADHD, because you need to have had the traits since childhood, and the traits need to be pervasively present in several areas of your life, and even more importantly, that they're causing significant impairment. It's the significant impairment that really tips you into thinking about needing intervention or not, and how appropriate and useful that intervention will be. So I hope you found that useful, and I look forward to seeing you in the next module. Take care.